Hey guys, 'tis I, Lorianna, the world's most favorite and cherished lunatic. I know you guys missed me. You like my stockings? I like them. I think they're pretty cool. We don't have a fireplace here in apartment city, but we got our stockings up. There's for the dog. There's for the cat. The red one's obviously Polaris, and the green one's for me, 'cause I like green. Anyway, let me get right to the point so I don't end up with a 10-minute video. I was doing a little bit of my own research over the diagnosis and possible diagnoses that the doctors gave me for my pregnancy. And it kind of comes down to the type of pregnancy that they're afraid I'm having is a 0.08 chance that I'm having. Well, I'm special to my mama, but I'm not special in any sort of medical way. So I started, digging into that. It's extremely rare. We're talking 1 in 30,000 to 50,000 people, which it's some big numbers, not as big as we've seen with COVID-19, but they're still sizable numbers. Given the fact that I wasn't on any fertility medication whatsoever, and given the fact that neither was my husband, that it is just a cyst that showed up slightly, it shows up as a possible fetus. I don't know how they do this in ultrasound shit, but it also showed up as a complex cyst on my cervix, which I know has been there for at least like 10 years and never really worried about it, but apparently it become a great concern to my doctor. And I can understand simply the excitement of seeing something you don't see every day, like really don't see every day, and the excitement of maybe dealing with something completely new and completely different. That came across to me. And that's fine. That's your job. Your job is to deliver babies and deal with these things. But it's my understanding that they teach you in the first year of medical school that when you hear hoofbeats, think horses and not zebras. So this extremely, extremely rare pregnancy, this 0.05 or 0.08, depending on, which study you read, is only really increased to a sizable number when fertility drugs are introduced to the female. Then you have 1 in 500. That's a significant jump. I have no fertility drugs on board, never have. So we're now go back to the hoofbeats. Let's not think zebras. Let's not think weirdness. Let's think probability, numbers, and math. So back to the horses, right? I have been diagnosed with a cervical cyst. Not that you all want to know all that is about me, but I'm not a sex penetration type person. Really, it's really very painful for me, which this might kind of clear up as to why that's been going on for like the past 10 years. And I don't know, I'm a little more helpful to like hopeful. I'm not helpful at all. Believe me, I ain't helping shit right now. I'm a little more hopeful today that I have a viable pregnancy and that we can grow this into something. And what's actually going on is a complex cyst of some sort. And the reason isn't just the numbers. The reason is because at this point, if there was a fetus growing in my cervix, I would be in incredible amounts of pain and blood would be everywhere. We'd be in the emergency room. As it's going now, I'm in no real discomfort whatsoever. I'm just, depressed because this doctor basically offered me the morning after pill right there. Like, yeah, want to flush it right now and try again? I'm like, not really. Not really. Because even if I have this rare form of pregnancy that is only, accessible to 0.05 of pregnant women, there's still an 83% chance that I could go through a procedure and preserve the other fetus and have it grow into a viable human. So no, I'm like, I didn't need the morning after pill. And I'm pretty sure that it's hoofbeats and horses and not zebras because, like I said, I'm special to my mama and to Jesus, but I'm not real special to the medical professional field. So that's where I'm at today. Thanks.